Welcome back, everybody. Derek Sue, your East Oakland advocate. Well, 8 years ago in July, went in for cancer surgery. I had colorectal cancer. I'd been diagnosed with that back in April of 2015, and it was. I'm thankful that it was caught early enough where it was very treatable and very survivable. And that's the whole thing about cancer treatment, getting ahead of it early. And then also after the aftermath, the years that start rolling by annually, you have to do your checkup, your annual cancer checkup. And so today was one of those events for me. And so I went in. They drew blood plus also a urine sample to test my blood sugar in my urine, and uh, the other things that they test for are different platelets and you know, white blood cell counts and things like that. So anyway, there's that's where the vampires got me today. They drew blood. It was only 2 vials of blood, so not a whole lot. I'm so used to being stuck with needles these days because of during cancer treatment. That's all I was doing, was being stuck with needles. It felt like being a pincushion, literally, and then the infusion uh, needle. You know, that was the scariest part. The size of the infusion needle, because the diameter was much larger than what I'm was accustomed to seeing. But then that's part of the infusion process too, and so they need to capture a very large vein so that they can put that infusion, the chemo, inside your bloodstream directly. And it's a boring process. It takes an hour, and I was going twice a week on Tuesdays and Thursdays for a month. And then before that, I was going over to Summit Medical because Highland Hospital, Alameda Health Systems, had not installed their MRI unit yet. And so my Alameda Alliance Insurance, which was the health insurance for low income and the homeless. And that's what I'm on, Alameda Alliance. And they paid for uh, Summit Medical to do the radiation treatment. And I went there for 3 weeks, 2 times a week. And that was on Tuesdays and Thursdays also. And so you know, the radiation treatments wasn't a big deal, but you know, if you're going to have kids, you need to have kids before the radiation treatment, because even though they try to protect your reproductive organs, um, usually the outcome is not very successful. And so I just wanted to say that I didn't want any kids anyway to begin with, and then once I got through with radiation treatment, it pretty much had sterilized me at that point. And so, ladies, also, the same thing can happen to you. The radiation can sterilize your ovaries, just like with myself, it sterilized me. And then what the radiation didn't do, the uh, the missteps in during the surgery, finished off the rest. Which, again, like I said, I didn't need any kids. I didn't want any kids. I already raised a stepson, and so I have the experience of raising a child. Yes, it's not mine, but I still went through all the headaches and heartaches that any parent would go through. And then I spent a tremendous amount of money uh, putting him through school and trying to put him on a path, a career path, which would be beneficial for him. uh, and it was difficult for him because he's so tall. He's 6'10" now, and there's just not a lot of jobs that pay enough so that a person of that size can afford to live. When you're that tall, you can't go into a regular store and buy anything, even socks. You can't even buy socks when you're that big. So that's why, we try and make sure that they have a career path that is uh, more inclined to what their income needs are going to be. So, in closing, my life literally was changed through cancer, and that's the case with pretty much everybody. Their life changes drastically. Myself, I was very active, very outdoorsy person. After the treatments and the recovery period, um, it really limited my mobility. Plus, it affected my balance, and so there's things that changed in my life. I lost a lot of feeling in my feet, so that's why I can't go snow skiing anymore, because I can't feel the edges of the skis and what's happening. And that's also why I stopped driving back right after the surgery, because I lost feeling in my feet. I also had lost a lot of feeling, about 60% in my fingers. All of my fingers and hands had lost a lot of feeling. But fortunately, within a year, on my hands, they came back. On my feet, it's taken more time, uh, because I also was pre diabetic. And so that complicates the matters, uh, and more risk. But cancer treatment and being a cancer survivor are life changing events, and I'm thankful. I've been blessed. This is my 8th year since the treatment, and I'm still cancer free. I had a couple of scares early on, uh, back in the 4th year, in that would be 2019. There were some additional polyps that showed up in my colonoscopy checkup. Yeah, they were still doing colonoscopies on me, and they found a few polyps in there, but they removed them and they weren't serious. And then 2 years ago, I had a growth on my head that would not, once it popped, it never healed. And it was about 6 months, and it was still not healing it before I contacted the doctor. And then they arranged for a biopsy and the removal of that. And then they put 2 stitches in there, and it's been fine ever since. And the result of that was that it was a benign um, uh, thing that they removed from up here on the back of my head. So things start growing. I don't want to be a mushroom farm, having all sorts of growths all over my head and body, but that's what it feels like these days as you get older. And the importance of seeing your doctor regularly, and getting your checkups, and getting your tests done in a timely fashion. I was pretty bad on this go round with my tests. I didn't get them as early as I should have, because my doctor's been bugging me to get my butt in and get those tests done since March, and here we are, July. Yeah, that was my fault. I've been procrastinating. Plus, I've been very busy with a lot of projects, a lot of meetings, helping the homeless community, and also my community itself right here in East Oakland. Thanks for joining me today. Check with your doctors, make sure you get your checkups, and take care of yourself. Thanks for joining me. We'll be right back.